He thought that was hard. Wow. I want to end AIDS in America, and you are exactly the right people to help me do it. You might be poking your neighbor and saying, is AIDS really a problem in America? Don't worry, you're not alone. We all know the horrible devastation in Africa and developing countries around the world, but not many people realize that there are more than 1.2 million people living with HIV here in the United States of America. But first, I want to take you on a little journey. Actually, I think the way to say this is, have you ever been on a path you didn't intend to go down? On a trail that wasn't on your map? On a journey you didn't intend to take? Well, I have. For me and my family, that journey began in a small, white exam room with my mother and father and a doctor in a white lab coat who told me that I had HIV. I was 19 years old, and it was 1988, 25 years ago now. For those of you who can remember 1988, it was a terrifying time to get an AIDS diagnosis, or an HIV diagnosis in my case. He said, don't read anything, it's too confusing, and don't tell anyone. This could really ruin your family's life. And in that moment, he locked us down in this shroud of secrecy and stigma and all the things that you may or may not know to be true about HIV. An HIV diagnosis in 1988 was a death sentence. Life expectancy was 6 months. So my first goal was to be 20. An HIV diagnosis in 1988 was also the introduction of impossibility. Dr. Gordon did such a beautiful job turning impossibility into possibility. And I know a little bit about that. It's been an incredible journey these past 25 years, and it's full of terrifying moments and really wonderful, joyful things. I spent the first few months of my diagnosis having this recurrent dream that I would be in a horrible car accident and I'd be cut up and bleeding, and people would be running to the car and they'd say, and I'd scream, no, get away, I have AIDS, because I was terrified that I could actually hurt someone, let alone someone that I really cared about. I got through that process, and over the next several years, I saw my health decline, and in 1994, I got an AIDS diagnosis. And for those of you who don't know the difference, HIV is the human immunodeficiency virus. It's the virus that causes AIDS. And an AIDS diagnosis in the early to mid-90s was really bad news. I had gone through all the treatments that were available, and the best option I had was to get on a clinical trial. We lived in Atlanta, Georgia. The clinical trial was in Albany, New York. That seemed fairly impossible, briefly. And then we found possibility somewhere along the way. And I made 2 trips, unfortunately, 2 trips to Albany, New York to try to screen for this clinical trial I desperately needed access to. The irony of which is I needed access to this medication to stay alive, but I was too sick to get on the study. After an incredible moment of luck or twist of fate or something that really went right for me, after being turned down twice, I had a doctor call me back and say, I think my nurse is dyslexic, your numbers were high enough, you're on the study. It was like winning the lottery. So in 1994, I got access to one of the protease inhibitors that has made up the cocktail regimen so many of you may have heard peripherally about in the media over the years. So the journey is a long journey, and we don't have time to go through the whole journey right here today because we have something far more important to talk about. I think it is important for you to know that although there have been a lot of tough moments, there have been some incredible triumphs. In 1999 and 2000, I did a Thru-Hike of the Appalachian Trail, which may mean you think I'm crazy, for 2,167 miles, roughly, who's counting, from Maine all the way home to Georgia, because it was a childhood dream. And perhaps the biggest dream in my world was the dream of motherhood. The thing I wanted most in the world was to be a mom. And the thing that was really tangible about an AIDS diagnosis was that I was never going to get that opportunity. Death was a little hard to grasp when you're 19. But you can't have children. I got. But the data got better and better. The science was good. My health was good. And by 2002, I made the decision and was fortunate enough to give birth to a healthy, HIV-negative baby girl. And 20 months later, her sister, and these were the children I was never going to have. These were my miracles. And for some reason, although I've told that story 1,000 times, I still do this. But that is a triumph. And I think that we're at a dangerous moment in this talk right now where I could spend another 7 or 8 minutes making you feel very morose and sad. But that is not why I am here. I am here because we have an opportunity to not hear any more of these stories, to not have anyone else have to tell you their horrible story of living with a life-threatening disease that we can prevent. Now is the moment. You might be asking yourself, well, why is now the moment? We're 30 years into this, we all know about condoms and safer sex. But we have far more than that in our toolkit now. And we have what we need in the United States of America to end the HIV epidemic with our behavioral interventions and with our biomedical interventions. And what that means in real English is that we have the strategies and tools to help people become aware that HIV is all of our problem, get tested, and if they're negative, protect themselves, and if they're positive, get into care, because somebody who is on treatment and successfully managed with HIV will not only live a longer, healthier, happier life, they will also not transmit HIV to anyone else. We now have the data and the science for that. So we have this great and wonderful and robust toolkit. Why aren't we employing it? 50,000 people, more than 50,000 people are infected with HIV every year in this country. This is a preventable disease, right? This is, how many of you like to win? Does that mean the rest of you like to lose? Really? Okay. How many of you like to win? Right, okay. That's what I thought. We have something we can win. How exciting is that? We get to be the generation that decides this is not acceptable. 50,000 people, that's 20% more than the sold-out World Series game at Fenway Park. Every year, get infected with a disease that we can prevent. Think about this. If I said, in your pocket or in your possession, you have the tools to make sure that nobody in this country ever has to get breast cancer again, what would you do with it? We have those tools. Here's the tool we're missing in our lovely and robust toolkit: the will. The will to make the change. So you might be sitting there thinking, Oh, come on, really? Does this mean we need to write checks? Is this about money? Is this about research? I want to be clear. When I say we can end the HIV epidemic in the United States of America, I do not mean we have a cure. There's incredibly important work going on in cure research and vaccine research, and in order to attack the global pandemic, we must continue that work. But we're in a novel place here in the land of privilege. We have what we need to turn the tide here in our country. You know, the American people, through the US government, have been global leaders in the fight against HIV, and we have done amazing stuff in places nobody thought we could ever make a difference. We have turned the tide. We are seeing the rates of new HIV infections go down in the hardest hit regions of sub-Saharan Africa, but not here at home. How do we justify that? Are you okay with that? I'm not okay with that. I'm not okay with that because my daughters don't deserve that, because every week or 2 weeks or 3 weeks I have to pick up the phone and talk to somebody who's been newly diagnosed with something they didn't have to get. We owe it to ourselves and to our community to do better. So why is it so hard? HIV kind of speaks to all the ugly, kind of underbelly, hard things we don't like to own about ourselves. It's about poverty and sexism and racism and homophobia and violence and all these things that we really want to be somebody else's problem, but they're not. They're ours. So what could you do? You could all decide today to muster the will, the desire to make a change. You could go out and get an HIV test. I will save you from asking you how many have had an HIV test. But think to yourself, when was the last time you had an HIV test? If it's been more than a year, consider getting another one. It's a part of preventative care. And don't waste any time telling me why you're not at risk. Because there's something more important in just following that step, and that is that you are helping to normalize HIV. It doesn't become about who you are and what you've done, but instead about taking responsibility. So if everyone goes out and gets an HIV test, and by the way, all conversations about changing healthcare and other things aside, that is one of the things that is now covered by your health insurance. Everyone should get free preventative HIV screening. And if you don't want to do it at your doctor's, Walgreens and CVS have an over-the-counter test where you can swab the inside of your mouth. It's like a pregnancy test. I know none of you have ever done those. It's really that simple. There is something about taking a stand and saying, we all need to know. We all need to know. Because if we know, we can do something about it. So that's one thing you do. You can go out and get an HIV test. You can think of 5 people in your life, friends, coworkers, family, who you can say, hey, did you realize that 50,000 people were being infected in this country every year? Have you been tested? It's probably a good idea. And you can muster the will. You can talk to the people who represent you, your policymakers and decision makers. If you don't talk to them about it, it is not going to be on their radar screen. If you don't say, hey, listen, I got a lot of issues I need you to deal with, but I just want to make sure you realize that HIV is not something we should be dealing with as a community. What are you going to do about it? I hope that in these few minutes, I've helped you think about what you might be able to do. 30 years ago, we had 50,000 motor vehicle-related deaths a year because we didn't have seatbelts in all the cars, and everybody said, no way, we can't fix that, right? Car companies won't put seatbelts in cars, and people won't buckle them. Now we have 20,000 and about 4 times as many miles driven. We can overcome lots of things. And generally, these are the little things. You all have a role to play. I started this by saying, I want to end AIDS, and that was wrong. I misled you. We need to end AIDS in America, and I need you to be the difference that makes a difference. Thank you.